Hi, I'm Dr. Mountford, and I just wanted to do a short video explaining the approach that we take for people that have jaw pain, which is called temporal mandibular joint, this joint right here, and how we treat in our office temporal mandibular dysfunction. It's called TMD, and a lot of people suffer from that. It causes pain behind the eyes a lot of times or up into the head, and can really be very debilitating. So the first thing that we need to do is we need to make sure that all the muscles around the neck and the jaw are relaxed. There's a lot of times with that jaw getting really tight, those muscles get really tight around it. So the first thing we do is we take a look at certain things like the platysma, which is a muscle that goes right along the front of the neck, and we do some gentle muscle work in this area and look for areas where it's bound up and tight, and we do that on both sides. We'll also look at the sternocleidomastoid muscle, the SCM muscle, comes from here. This is a really common one that needs to be worked on pretty frequently. And this is just some gentle muscle work to work on this. Now, Lisa here doesn't have huge issues, so I'm not going to spend a lot of time, but according to the person and what kind of situation they have, I would vary the time. We also look at some other muscles in here, the scaling muscles, make sure that those are doing well. A lot of times these muscles, when they get really tight too, can shoot pain down the arm and cause neck pain as well. Of course, the neck pain is usually due to what we call a subluxation, or a problem in the neck where it's not working right, and that can lead to a lot of this muscle tension too. So we're just going to loosen these areas up as well. Now, the next thing that we do is we work on the neck itself. As far as the joint mobilization, we want to make sure that the joints in the neck are functioning properly. And I wouldn't do this without getting an x-ray first, just to make sure I know exactly what's happening in there. And so once I have that information, I can make a specific treatment for that neck. And that can happen in a few different ways. Sometimes it can be a little click, a specific adjustment. There's other things we can use too. This is called an activator, and it does a little tap. And for the neck, it's extremely gentle. And then the third thing that we can do in a situation where people are very nervous about having their neck adjusted is something called a figure 8. And a figure 8 is something where I put a little bit of axial compression here, and I'm feeling for the glide in the neck. And often you can feel a catch, and when you feel that catch, you can actually mobilize around that catch until it starts to loosen up. And this is a very nice way of mobilizing the neck. We just want to make sure that's cleared out, because that often causes issues that radiate into the jaw and lead to problems with the way that the jaw works. Once the neck is cleared out, we start working on the jaw itself. Lisa, if you can open your mouth. So we'll look at jaw tracking. Her jaw kind of shifts off to one side. And we can feel jaw tension here as well in the masseter muscles, up in the temporalis muscles. So I would work out those, as well as coming inside the mouth, looking at the inside for the different muscles that are in there, like the inside of the masseter muscle, for instance. And we can also see too, if there's tightness with the way that the jaw sits on one side or the other, you can feel pretty readily how tight it is on one side. And we go underneath also the zygomatic arch, and she's got some tension right there. And so we'll gently work on that. With the muscles in the jaw, they can be very sensitive. So we usually have to be pretty gentle with these things. Also, some of the other things that we'll do as well is mobilize some of the sutures in the neck, in the skull, open your mouth, as well as traction the jaw out and help the jaw to track properly, again, depending on the person, to make sure that it's sitting in a better position, close and open. And sometimes too, issues in the jaw do relate to the way that the teeth come together. It's called occlusion. If the teeth don't come together properly, close, then no matter what I do, if the teeth don't come together properly, the jaw is going to continue to be a problem. So sometimes dental work is necessary for this kind of thing. After we're done working on the jaw itself, we work up into the skull. There's several different sutures in the skull, and so I would just go from one to the other and just make sure that they're functioning properly and that they're moving. Most people think that a suture is actually fused, that the skull is completely fixed. Actually, there's tissue on the outside of the periosteum, goes onto the inside, and it becomes, it's called a dura mater, and all that means is that the bones aren't fused, they're slightly movable, and so we want to make sure that those are working well, and that there's some movement in those. So, after going through this process, making sure that the sutures are mobilized, and again, it depends on the person, it's generally the end of the treatment, and we start with the most simple form of the treatment and move on to more advanced as long as, as her body is ready for it, and that's our approach to the TMJ. Thank you for listening, and I'm Dr. Evan Mountford. If you have any questions, please feel free to call our office at 916-774-6699, and consultations are always free.